So we have got a really, really fabulous workshop this morning exploring system leadership in practice. I will introduce people as they take their part in presenting, but a really fabulous panel. We're going to start with some content from examples of system leadership in practice, and then Nicola and Nick will talk through some key findings from the report that they've produced. We'll have some breakout sessions on some key themes that have emerged through this work. And then there'll be time to share back and explore best kind of next steps. We will be finished by 11:30, and I can promise you it is going to be an enjoyable and productive use of your time to be with us. So I'm really, really pleased that you've been able to join us this morning. Just a few housekeeping things before we get started. So there are closed captions available. If you'd like to have them displayed, in order to access them, click on the top of the screen under More, where you'll see Language and Speech and Closed Captions. If you have any technical issues, you can ask for help in the sidebar, and we have people here who will try and support you. We are going to record this workshop so that you can view it back. And as I say, would encourage you to keep your camera on as it's an interactive session. We particularly during the breakout groups, that will be particularly useful. We haven't factored a break into this session, but if you need one, please do take it and come back in. Great, so let's get into the substance. We're going to start with a bit of a kind of warm-up to understand where you're at. So if we can start in the chat with answering the question, system leadership for me is, just add a few words. We're going to populate a word cloud from the responses that we have in the chat. So if we can, if our panel could start off, help setting the tone with that, please don't hold back. And we can start to see what people are identifying here. Working across partners, real partnership, people coming through strongly, choppy, I'm loving it. It's always tempting to put positive words when you're in these exercises, but all contributions are very welcome. Yeah, if we think about what system leadership means as distinct from other forms of leadership, I know we're going to get in some really interesting conversations later. Thinking and action, going across traditional boundaries, challenging but worthwhile. I'm loving it.
Annie, I think you turned your mic off.
Thank you. I promise you, I was giving some really wise commentary on what you were sharing in the chat. So yeah, fantastic to see both some really positive sentiments there and things that feel really important, while also recognising the complexity, some of the things that are challenging but worthwhile, I think captures it for me. Okay, if you haven't added yet, just maybe another few seconds to add that, and then we'll move into the conversation. Looks like it's slowing down. So thank you very much. I don't doubt that the people we have in this workshop will be bringing a huge amount of expertise and lived experience around system leadership. So we really want to make the most of that in the breakout conversations. But first, let's start with sharing a little bit of content from the work that we have supported. Just going to say a couple of words on the background, the context for this work. So in Kew, we established a forum for the national leaders of improvement across the UK and Ireland. We did that coming out of the back of COVID because we were realising that actually we needed a space to think about what's needed when leading and enabling improvement across big systems. The connections that we made through that work actually kind of led to the Northern Triangle project that we ended up then supporting, that generated the really rich insight that we're sharing with you this morning. It felt really important to us to be supporting that type of work because I think in Kew we have been tracking, I would suggest supporting kind of an expansion in how we think about improvement over the last kind of 10 years since we started Kew. So we've really noticed people thinking more and more about the breadth of what we're trying to achieve when we're improving healthcare. But we're also hearing that our aspirations have grown, our ambitions have grown, but actually the types of leadership we're now asking of people are really, really challenging. When we're trying to work across whole pathways and systems, we're in new territory that will require a different kind of response. So we were really keen to kind of push our learning and understanding about that. This morning isn't just going to be of kind of theoretical interest, although I think it will be certainly that too. The type of work that we're talking about when we're discussing kind of system leadership feels like absolutely critical to neighbourhood health, to so many challenges for patients where they're using services that don't sit within neat organisational boxes. So, as I say, a little bit of context, really pleased to be supporting this from Kew. As people who aren't Kew members yet may have noticed, we have explicitly expanded Kew to not only welcome people who identify themselves doing improvement, but also kind of change and transformation. That's to recognise that actually these different fields of change and improvement work are quite different from certainly when I started my improvement career, and it was understood as a much kind of narrower form of quality improvement. So really excited about the significance of this work, and knowing a bit about the content, I know we've got a lot of great stuff in store. I'm going to start with Diana and Elsa to share a little bit more about the background of this work for them. Diana, over to you first.
Thank you very much. So I'll just get on. I'm just going to take control of the slides, if that's all right. So interestingly, so this work has taken us from napkins to clouds. So we, as Penny said, Elsa and myself and a group of other people, and eventually Catherine, we were part of that community of leadership, really beginning to examine system leadership. And one of the nice things about that time that Kew and the Health Foundation gave us to come together was actually a bit of a headspace outside of our day job, and a bit of a space for us to have the time to do some reflective practice. And over that, as all amazing things happened over food, over lunch, we wrote on the back of a napkin an idea, because the group of us from the north of England and Scotland recognize something in each other that we were jointly struggling with, that there was a sense that the question about how do you scale up QI to help you tackle the problems at the system scale was kind of not quite right. There was something that we were feeling and sensing that was different, that we needed to be able to really articulate about transformational change at a system scale. And I think we had a shared passion in that, real belief that it came from the people that live in our populations, that real understanding of their stories and journeys, that humans are complex things. And so no matter how organized the system that you put together is, you add humans and it immediately becomes madness and complexity. And so finding ways to grapple with the granularity of each individual's unique life experience and be able to design a system that worked to adapt to that required a slightly different way of approaching and thinking about the problem. And so we presented to Penny and asked for some money to put together a project to do this, which was a bit of a journey into the unknown together. We did fall into the trap of traditional thinking, of trying to define a project and a piece of work we were going to do, and we were going to track through a piece of work with pre-agreed outcomes and goals. And that didn't really work. That was, as systems leadership is, a bit choppy. And so actually what we realized, we needed to do our own work, the work that mattered to us, but to come together to do reflective practice around what was working and not working, to create a common sense of the challenges we were facing, trying to support a shift in a system to think more sustainably, more preventative, more community-based, more about the people and less about the structures, less about performance targets and more about the genuine impact we were having on people's lives. And we also had the joy of bringing in many amazing people to talk to us. We heard, we've all done our own research. We realized we all had amazing brains full of brilliant things that people have shared with us in the past, and some amazing colleagues who came and shared work with us that then we were able to take back into our own systems as we were trying to help our 3 different areas make this change towards system leadership. Now, for us in Scotland, what that's done is we've been able to pull together what our quality management approach and the work we were doing around transformational change in many different guises, from work with service design and getting it right for everyone, to thinking about the QI journey and the QI journey at scale and quality management. And what we've now done is taken all that great reflective practice and had the joy of being able to have our challenge thinked by Ilse and Catherine and their teams that they've got around them, to this, which is the Scottish approach to change, which is referred to and looked at by Nick and Ilse, who we were able to commission to kind of further that reflective practice about what that shared sense was. And things that are really important that we recognise in this is, if you see this as a noun and a framework, we started in the wrong place. Really important for us was seeing this as a dynamic, almost living system. So one of the things I often say when I talk about the Scottish approach to change is we don't abbreviate it. And we don't abbreviate it for 3 really good reasons. We don't abbreviate it to SATC because it turns it into a noun. And it's much more of a verb. It's a way of being. We also want it to belong to everyone. We recognise that what we'd done with change was give it to pockets of people that we gave labels to. And a bit like what Penny was reflecting about the whole movement of Q, was trying to democratise that sense of change and where that change is. And so the minute you call it SATC, what you have done is you've made it a cliquey jargon club. So only people who know what SHTC is and who are trained in it can do it. But everybody can understand what a Scottish approach to change is. And the third bit is, being a woman of a certain age, SHTC is also the same abbreviation as Sex and the City. And it's not one I'm personally identifying with. So the Scottish approach to change works by thinking about this as and I don't have the tech. People keep promising me they'll give me the tech to do this. I want this to be a pulsating thing. But at the minute, PowerPoint and graphics are what they are. So what we recognise with this, these 5 things, they started with 7 nodes, and Mark and Gateshead had started with things he called 5 whole cruxes, which was a bit weird. So we had 7 nodes. Feedback from testing this with system leaders was that 7 was too many things for them to remember. So we got to 5 because that's literally what we were guided to. The most important one is this superpower in the middle, this learning system that sits as the heartbeat and the drum of how to behave. You start with a clear vision and purpose, but you do it with rigor. So learning is a kind of fluffy thing that you do on the side. You do it rigorously. And I think that's the experience that Ilse and I had, that rigor that we put coming together with this, because we had a project and doing our reflective practice and taking it really mattered. And that rigor is critical, because what it enables you to do is, as you're working through your steps of change, here, at each step, you're feeding it back into your learning system. You're feeding what you're learning here. And it might be, as you're checking that learning against your vision and purpose, you're checking it against your quality plan, it might require you to adapt. And it's that ability to constantly learn and adapt. Because you're doing it with rigor, you're doing it in regular ways with governance processes that are written down. And it starts with people at the heart. And so, not to sort of overtrail what you're about to hear from Nick and Nicola, the thing is, if you regard this as a rigid structure where you go here and then you take it into your maintaining quality and you go, have I done it? And you do a tick or a cross, and either people are happy or not happy. You don't adapt in the way that the system needs us to adapt. One of our pathfinders for this work in Dumfries came to me and said, we are failing on our project because we'd got round to here, we've got a clear vision and purpose, we've got our rigour in place, we've got good culture that's really engaging in person-centred work, and we're spending a lot of time listening to our staff and our population. But as we've been managing our data, what we're understanding is the way we've set this project up isn't right. So we're going to rip it all up and start again. I'm so sorry, Diana, to have failed you. And I said, you have not failed me. You are my case study. You are my champion. You are my hero, because what you have done is, because you've got your clear vision and purpose in place, you had a quality plan. Your data that you were capturing here as you went round here told you it wasn't right, because you were doing this work of learning rigorously. So you have adapted your quality plan, but it still aligns with your clear vision and purpose. And so the work hasn't gone backwards. It went back a wee bit to here, but has accelerated itself back round to here again. And that is because it's done exactly that work of seeing it not as a rigid clock, but as a way of adapting and being as a system. And that learning and being able to talk that through this project with Q and with other leaders to help us think and understand that this is how change really works has been really important. So I'm going to hand over to Ailsa now to talk about how we came in contact with Nick and Nicola.
Okay, that's great. Thank you very much, Diana. Morning, everyone. It's great to be here with you. And one of the things that we were really keen to do as we built on this work together, especially when we did the shift from can we design a project that we work on together to how do we create a learning system so that we can be adaptive. And we all know and appreciate, don't we, that we work in complex adaptive systems. So this for me is much more difficult than improvement work within an organisation where lots of us have been spending a lot of time focused on improving our processes rather than within one organisation, which is difficult in itself, but significantly easier, I think, than doing whole system work. So one of the things that we were really keen to do as part of our Northern Triangle grant through the Health Foundation and Q community was to really evaluate the work that we were doing, because I was really mindful of the time I spent in the system leadership sessions that Penny described at the beginning. I was at the time working on NHS Impact as the Improvement Director for the National Improvement Board, so I was fortunate to be able to attend those discussions. And what really struck me is that we still don't really understand with an academic rigour that we have for other improvements, the work that is needed at system level. So it felt particularly important that we really focused on evaluation. And I think for me personally, it was a reflection of some of the learning from the work that I'm sure most of you will be familiar with from Professor Sir Chris Ham and his report, Change at Scale in Health and Care. And that was work, I think, Penny, you were involved in that work, weren't you? It was work that Chris undertook in collaboration, but there was some key learning for me at that time. And what Chris Ham talked about was successful change spreads through people, not just policies. And I think we quite often, as Diana has already alluded to, produce documents and policies, and we're all very good at designing our strategies and having a core purpose. But if we don't work successfully with our colleagues and our local populations, that work just doesn't spread at scale. And we had, some of you may remember that John Dean and I did a webinar in a series very similar to this on the work that we've done around engineering better care for older people across Lancashire and South Cumbria. And what we really learned in that work is that leadership is critical and relationships and networks are what drive improvement. And that also came out of Chris Ham's report. And then for me, the piece of work that I think is really critical, and I'm just delighted, Nicola, that you and Nick and the team have managed to do this for us, is to really think about what leadership skills and abilities we need. I think this requires a different style of leadership. And I'm not going to talk any more about that because I know Nicola's going to cover that with you. But it felt really important for Diana, Catherine and I and our wider teams when we were doing this work that we absolutely had that independent evaluation. It was one thing us doing the work and, you know, it was choppy, but it was great fun at the same time. So it was difficult, being honest with you, because we had some real changes in the NHS structures in England. So we know that, you know, the changes to NHS England and the ICBs made the work, I think, more difficult. But it felt really important to us that this work contributed to our learning, and we made a commitment in our Northern Triangle grant application to Penny that we would share this work with the Q community and wider NHS social care and other colleagues who are interested. So I'm delighted that Nicola and the team were able to do an independent evaluation for us. That independence and objectivity is really important. And for me, Nicola, one of the things, there's lots of things that resonate from your report, but for me, the 6 pillars of leadership are absolutely critical for us as an improvement community. So I'm delighted to be handing over to you and Nick to talk us through the evaluation.
Thank you, Elsa, and it was an absolute honour to be asked to do this work. And I know, speaking for Nick as well, that it was something that we found incredibly interesting and thoroughly enjoyable. And we're delighted to bring the report that we did called Up Clocks and Clouds about leading system level change in health and care, and really delighted to be here with you this morning to share some of the high level findings from that report. So the way that we're going to do this is we're going to share sort of 3 sort of key components of the report that we surfaced through our interviews with senior leaders who are leading change at system level in the northeast of England and Scotland. So if I begin here with part 1, which is just picking up on what Elsa mentioned there about it being a different type of leadership that's needed, because actually it's a different species of work. And this was one of the first things that sort of came to light when we started talking to senior leaders about how we do system level change. And in our early conversations, it got me thinking about this parable of the blind people and the elephant. I don't know whether you're familiar with this, but I think it really captures some of the challenges that we face when we start sort of thinking at a system level about how we do this work, and the tensions that emerge as we're trying to sort of execute this in a meaningful way and to deliver the transformation that we desire. So if you're not familiar with this parable, so you've got six people blindfolded, sort of each seeing their own part of an animal, or not seeing because they've got blindfolds on, of course. But then describing what they see, so describing their part of an animal really vividly, really powerfully and strongly. And you know, you've got the person at the side that's feeling the side of the elephant, and they're saying, well, this is a wall, you know, this is a large, big wall. And then you've got someone maybe touching the trunk, and they're saying, well, this is a snake. Someone on the tusk will say, well, this is a spear, you know. At the back, maybe it's a rope. You get the idea. So we all see our own, so our narrow part of the system. And this is what it's like when we are managing within our own sort of part of a system. We only see our piece of it. And so when you bring people together, we will argue forcefully, this is what it's like for me. This is what I see. This is how we do it. And of course, these issues can create some tension in themselves. And so when we think about system level change and system level leadership, it is about humility. It's about being open-minded and listening to others and making the space to do that and making the space for collaboration. It takes a long time, it takes intentional effort, and it's not easy. Yeah, it's hard because we are used to our part of the system. So I think that parable is really useful illustration of some of the key challenges. And this was one of the sort of the first things that we learned as we started talking to senior leaders about the challenges of doing system level change. So here on this slide, we use a quote from Russell Ackoff that really kind of is the foundation of system level thinking. So when we're doing systems thinking, what Russell Ackoff said was if we have a system of improvement that's directed solely at improving the parts, each taken separately, then you can be sure that you will not be able to improve the whole, the system as a whole. And so this really encapsulates the difference between doing improvement within a single organisation versus doing it at a system level. And we use this table here to sort of draw out some of the key differences. So to begin with, the goal is different. So within an individual organisation, it's about efficiency primarily, doing things better. When we are moving to system level improvement, we're thinking about how do we work together to do better things. Nominal value is another important difference. So within an organisation, that value is determined by the organisation itself. When you move to system level improvement, it's much difficult to work out what that nominal value is. It needs to be co-determined with other system partners, people and communities. So think back to that parable of the elephants, and we need to spend time to do that together, be open-minded and have humility and work together. Jurisdiction was an interesting one when you start to think about system level change, and you think, within an individual organisation. I remember in our early interview, someone said to us, if I want to do improvement within my organisation, we make a plan, we go to the team at the department, and we know what to do, and we do it. When it comes to system level improvement, actually, it's much harder. It is a different species of work, and you don't have that jurisdiction in the same way that you have within an individual organisation. Similarly, knowledge is centralised and specified within an individual organisation, but it's distributed and unspecified as we move across the system level. Okay. So, as I mentioned, I think we went on a journey with this as well. So we kind of came from noticing the sort of the tensions among bringing different partners from different parts of the system together and how they play out, to actually the different change beliefs that seem to be driving the way that people think about improvement and change. And so those change beliefs really sort of are on a spectrum. On the one hand, we've got people who really see this as a relational piece. And it's really, really important that we invest in those relationships, and it's all about that. And then on the other side, you've got people that are saying, well, this is transactional. We just need to say exactly what we want, specify it in a certain way, and then we can measure against that, and that's how we get the outcomes that we desire. And in between that, of course, there are lots of different versions and mixes of those two sort of logics, if you like. And that is what took us to Karl Popper's thesis about clocks and clouds. And his thesis essentially is that all clocks are actually clouds. Okay, so where we think that where we use a clock logic, it's about assuming that systems are predictable and controllable, like the clocks we use or the watches we use on our wrists. If there's a problem with it, let's imagine it's an old-fashioned watch, then we can change the gears and set it as it needs to be. And that is sort of the approach of many of the metrics, the activity-based metrics that we tend to use within healthcare. The idea that we can deliver change in a set way by pulling a lever, setting a metric, and so on. And then, of course, on the other side of that is the cloud logic, which assumes systems are complex and adaptive, which Elsa's also already mentioned. Healthcare are generally considered complex and adaptive systems. So the clouds represent the messy, human-centred reality of healthcare, where simple mechanical fixes like metrics, as like clock-based metrics, actually often fail to address that underlying complexity. Now, I'm not arguing one over the other. We need both. And we know that the art of leading change at a system level is about navigating between these logic, because there is a place for metrics and there is a place for the relational piece, and we need both together. The second part of the report talks about more elephants. So we call this the elephants in the room, or the intractable elephants. So, as I mentioned, we went on a journey with this work. We were looking to draw out lessons from senior leaders who are leading change through the different approaches in Scotland and in England. And actually, when we spoke to people, we heard a lot about the tensions that they were facing. And so we classified these as 4 intractable elephants. I'm not saying there isn't more. I'm saying that these are what came out through our interviews. And the big one, which I'm sure you're all familiar with, is what we call the gravitational pull. So there's this force that pulls attention, money, resource towards hospital-based activity. And that is created by the extensive use of clock-like metrics. So the RTTs, the referral to treatment times, the waiting times, and all of those things force us to direct attention and resources into the acute sector. And that obviously creates a bit of a problem for executing the left shift of hospital activity to community, treatment to prevention, and so on. And this came through in a lot of the interviews that we did. And I've just used a quote here on this slide that encapsulates this. So at the moment, the way that hospitals are set up is that we are paid for activity coming through the door, and that doesn't encourage the keeping people safe at home mindset at all. So you've got a bit of a attention paradox there in the way that we set the system up, and that creates that gravitational pull of attention and resource into to the right, if you like, to the hospitals. Then we've got the poverty paradox. So we know that a lot of hospital-based activity is driven by poverty. A lot of clinical crises are socioeconomic ones that are in disguise, and addressing the root causes of those requires confronting poverty and deprivation directly. Some of our interviews talked about this in great detail, and I think one of the overriding themes that came from here was that we've become, as leaders, we've become so removed from the people that we serve, and we need to actually spend more intentional time understanding those problems in order to address them, and that's time, attention, resources towards the left in order to address some of these issues. The third one is what we call the stewardship paradox. This we've covered really in the table that I showed you, the idea that regional leaders are held accountable for budgets and performance, but actually lack jurisdiction over independent system partners. So this creates a problem. Many leaders talked about the need for a neutral space for system convening and facilitating distributed leadership. A few people talked about the ICBs in England playing a role for this, and in Scotland, some of our participants talked about how the relational spaces that used to be there for this type of work are no longer there and need to be brought back for this type of work. And then the fourth one, again, might be familiar with, which is an inequality of capacity. So we've invested quite heavily over the last probably 2 decades, maybe 3 decades in quality improvement. And you know, that is amazing. I think we've made some fantastic progress there. But now what we're seeing, of course, when we move to system level work is inequality of capacity, where primary and social care sectors have less capacity, less experience, and less capability for improvement. So I think I now will shift over to Nick to do the leadership pillars piece of the work.
Thank you, Nicola. So if we continue our sort of thesis that the challenges that Nicola talks about, the uncomfortable truths, the elephants in the room, the clash of leadership logics, if they require a different, if they require a different approach, then we require a different species of leadership. And so through the data, we identified 6 pillars of system level change. And I'm going to go through pretty promptly those 6 pillars, and then we are ready to perhaps have a break from us. And then we'll go into some breakouts and sort of give you an opportunity to sort of make sense of what we've been talking about and propose a few questions. Okay, so I'm going to flick to the next slide and go through the first 3, which are centered around the internal shift. Okay, so this is sort of the internal shift for a leader. And this is all built on our argument. And if you agree with our argument that no one has effective jurisdiction over regional and whole systems. Okay, as much as we'd like them to be, as much as they might be drawn on an organisation chart or anything like that, this notion of effective leadership is contested. So our thesis is that no one currently has that. So if that's the case, then perhaps 3 internal shifts are required for those who enter into the systems leadership space. The first is hierarchy to stewardship. So if no one's the boss, if no one's the boss, then you have to act as a steward. Okay, and that means a steward in service of system purpose. Now, the curious thing about being in service of system purpose is you have to have some notion of what system purpose actually is. So, you know, this is a lot more complicated than it sounds. And I suppose I would argue you won't get very far if everybody's assumption around system purpose is just to protect secondary care or protect the front door of hospitals. So we have to think quite carefully about layering this up so people can act as a steward of the whole. The next of our 6 leadership pillars is the boundary spanner. So this is where in a place where the forces that fragment and create silos and barriers between organizations are not going they're not going to go very fast. If that's the case, then the necessary solution to that is to have people who can work across those boundaries, who have the humility to park their institutional hierarchy and build trust and relational capital to be the glue in systems. And they're effectively the kind of catalyst for getting different parts of the system to work together. And then the third one in terms of this internal shift is perhaps the one I think would be the most challenging, is this moving into the co-production space. Now, I've no doubt that many people in this room know a fair bit about, in fact, way more than I do about co-production, but a couple of things that I think are important. The first is that if you look really deeply at the left shift and the 3 shift strategies, what it comes down to is a co-ownership of health outcomes with citizens and communities. Quite frankly, you can't outrun ill health with a reactive system. And when you look at all of the high-performing healthcare systems around the world, they've clocked that, and they are really investing in co-ownership. Now, to get to a place of co-producing new ways of working and new models with citizens and communities, 2 things are really, really challenging for leaders. We have to step into a space where we can hear and work with the outrage that should be there in terms of the state of some of our services and the inequities. Okay, so a deeply uncomfortable place. And we also have to set up these co-production spaces and these methods of co-production in a way that enables those who don't have institutional hierarchy to have equity in conversations and decisions. So we entered into a place where we had parity of equity in terms of decision making and power. Now, those things for institutions, for like the NHS and social care, those are 2 very, very deeply challenging things to enter into. So I'll move on to the last 3. So what we have here is the practice of systems leadership. 4th one, relational capital. So if the barriers are structural, they're not going away anytime soon, we've got the gravitational pull left, then the solution or the antidote to some of that is to invest in relational spaces. So trust and relational capital is the thing that will bridge the fragmentation of our service. So that's both a structural change, creating those spaces, but also investing in method and opportunity for people to work together and build social capital between them. Now, as Nicola said, what we heard from our interviews is nearly all of those spaces have been removed. The only opportunity for professionals and others to work across organisational boundaries is in transactional information exchange at the moment. So almost all of the opportunity is gone. So in order to do that, something has to change. Number 5 is in service of the system. Okay, so Nicola talked about Ackoff, and Deming would also say the same thing, that the relentless focus on local optimization of the parts of individual providers and institutions will always result in the global loss for the system. And I think this goes a long way to explaining why, despite relentless cost improvement programs, relentless change programs in providers in primary and in secondary care, the system cost continues to creep, because we're not looking at the whole. So at some point we have to get comfortable with sub-optimizing the parts, some of the parts, in order for the whole to move forward. And that goes against the grain of a lot of our performance management systems and our institutional performance management. So it's deeply challenging. And then the last one I wanted to touch on before we get moving to the breakouts is amplifying and influencing. So this work is really challenging. We don't believe individual regional leaders and local leaders can do this alone. So there is work to be done between leaders to help change and amplify and influence the wider system, to help create the conditions for different work to happen. So regional leadership is both external facing as well as internal facing as we go. So there are 6 pillars. Again, as Nicola pointed out quite rightly, you could argue there's probably some more, but these are the 6 pillars that came across from our interview data as the 6 pillars of contemporary leadership for system level change. So we'll move on to the breakouts. Okay, so I'm hoping.
Sarah, thank you very much. So we've got the next 15 minutes to really think about sort of sharing some of the high level feedback. So what we're going to do is just hear from some of the groups. So I'm going to invite Diana and Nicola to share first, then Penny and Nick, and then Adriana and Kirsty. I hope you don't mind, this is putting you on the spot, but I'd rather not feedback given I'm facilitating. So if you don't mind, Kirsty, I'm going to come to you to talk about what we discussed in our group. So can I invite Diana and Nicola to share first what you talked about in your group? So maybe Diana first and then Nicola.
Thanks. And we decided as a group that actually focusing on the leadership pillars was what the group felt most strongly wanting to talk about, because there was a sense it was the thing that you could take back quite with clarity to the work, to be able to make some of that the shift that we were talking about. And actually we talked around all 6. All 6 seemed to resonate with the group. We had a sense of the importance of the boundary spanner and people seeing themselves in that role. And I think one of the things that was important for us was recognizing that role exists at all job roles within an organisation. It doesn't sit within a hierarchy. It's a really critical role, and people should feel like doing that work is a leadership role at whatever their job role is. We talked quite a lot about the discomfort of co-production and people feeling like the opening themselves up to critique can be challenging, particularly I think in a culture with so much performance management. That opening up and putting on the table critique is a hard thing to then embrace co-production in the way that it meant. But we had a really useful insight in the people who've probably got the biggest view of the system and actually understand system, the system as it interacts and collaborates and connects with itself, are people who use it. And they probably bring a far more expertise and lens onto the system problem than any individual working in their area. So recognizing it's not just the expert in their own care, but expert in how the system actually functions was a really useful insight. And we shared a bit about no sense making about me without me. That idea that if only us in positions of leadership imply our sense on what we're seeing from user research or from user data, then we then rebias it with our own life experience and our own usual lens of privilege. And so actually making sure you're doing your sense making with people felt really important. We talked about that really important role of relational capital, the connection that people have, and particularly, in our group was a conversation about the role of the voluntary and community partners within that, to be really connected and have that relational capital with people who are working directly with those in need or receipt of care, and that they can help tell the power of the story and really bring stories and that co-production to life, because they have that relational and therapeutic relationship with people. And I would say in our experience, particularly around areas of mental health and alcohol and drugs, having that trusted therapeutic relationship that the voluntary sector can often bring, that gets you past trauma and enables you to do really trauma-informed equalities-based work. So that relational capital feeling really important. And then we ended up on the good stuff being in the dull stuff. That tension, that and amplifying and influencing difference, the recognizing we have leaders who have very prescribed accountability and duty in their governance, and then trying to work like a cloud. And that tension and that hold, and how you help amplify the spaces where people can be more cloud-like in that leadership space and in that governance, and how do we work with our non-execs and exec leads to help them think about governance and risk through a lens of learning and adapting rather than false assurance. And that was how we worked through the 6 leadership pillars.
Brilliant. Thank you very much, Diana. Nicola, over to you.
Thanks, Elsa. So well done, Diana, and being so articulate in the way that you brought your group's discussion together. But we had a discussion about the metaphors piece. I scribbled lots of notes furiously, but I can't. I'm not sure that I'm going to be as articulate there. But so we talked about, again, the importance of relationships. I know someone described their role as a service improvement facilitator as I talk to people, and that's how I describe my career. And the point being there that we could have all the tools, all the expertise and the knowledge and the rigor, but it wouldn't land if we didn't have those relationships. So they are really the pinnacle of how we do improvement. And then one of the points about learning how to do this at a system level and bringing people into the room. And we talked quite a lot about the parable of the elephant, and does that resonate? This idea of people seeing the different parts of the system, quite loudly asserting what they see, but not agreeing with each other. How does that play out, and how do you get around that? And one of the responses to that was we've got to listen to people, we've got to spend time doing this, we've got to understand the why, and invest time in thinking about what's really important to staff and to the people who use our services. And so that was key. We've got to meet people where they're at and walk in their shoes, I think was a really important point. There was some discussion about, similar to Diana, the need for boundary spanning as well. This idea that people don't talk to each other. We do our role within the system, we do it very well, we improve it, but we don't necessarily think about the system as a whole. And by doing so, we could be making an improvement that could actually have a negative impact somewhere else. So actually taking the time to understand and to listen to and to find out about other people's work is really, really valuable. So any members of my team that want to just chip in quickly if I've missed something? I think there's a time at the end, isn't there, Elsa? So I think we should have time for people to share. Yeah. So if I've missed something, I apologise.
No, that was great. Thank you very much, Nicola. That's great. And then Penny next, and then Nick. What did your groups talk about? And if you did talk about similar things, please don't feel the need to repeat that. Just add anything different or new that you talked about.
Some feedback from our group. So we chose to focus on the leadership pillars. We talked about how hard it was to get people in the room, and that the idea of creating a kind of shared goal, how challenging it was to kind of get to that point, and that even if you do establish a shared goal, actually we need to think about that in a much more fluid and relational way. It will be the way in which that iterates with people over time that will keep it meaningful, as opposed to something that's published. We talked about the importance of the kind of boundary spanning roles, but I think most of those points have been made elsewhere, and particularly about how hard it was to prioritise the interests of the system overall. We had a discussion about the kind of significance of like financial and other incentives that drive this like local optimisation of individual roles and organisations, and a bit of a debate about whether the culture and practice shift will happen without the incentives changing, or whether we can make progress on shifting the culture and patterns of behaviour in order to enable a different set of incentives. There were some positive examples within the group of how people were using like cross-pathway and different commissioning approaches to enable a different set of behaviours. I think another like interesting observation was that many of the things that we are describing here, we are observing within organisations, sometimes within individual directorates and departments. So actually in the complexity of many healthcare organisations, we're not sure that what we're seeing is just a feature of whole system working.
Yeah.
That's it from our group.
That's great, thank you very much, Penny. Nick, were you in the same group as Penny or a different group?
Different group.
Different group. So do you want to go next, Nick?
Yeah, well, I mean, building on what Penny's saying, so we sort of touched on all three, but the group really summarised, I think, what we were talking about in a really nice way. So there was a comment that lots of what we've been talking about today is the evolution of the improvement practitioner. So that's quite interesting, isn't it? About the sort of set of skills for delivering on the left shift strategy. So how do we co-produce a system-wide improvement? So there's it's quite interesting challenge there about perhaps this is the evolution. This group perhaps might be sort of self-selecting in terms of some of the beliefs, that's why we're spending the time here. So we talked a lot about some of what the report talks about people are already doing, and they could see themselves in some of that, but they also accepted that they perhaps sometimes are the exception rather than the rule. So we're a long way away from a shared sense of purpose and the 6 pillars and so on being universally valuable. And then the last thing we touched on was this kind of quandary around, we talk a lot about senior leaders needing to navigate the system, but the challenge, one of the group talked about was, well, if the challenge is 75% of the job is trying to figure out and learn how to navigate the system, if that is 75% of the job because it's so complex, how do you get anything done? And I think that's an interesting challenge about sort of, we spend a lot of time about bridging fragmentation and bridging silos and joining up and making communication better. But I suppose one of my hobby horses is we need to be concentrating a lot more on making the system much simpler in the first place. Perhaps it is too complicated, and we need to challenge ourselves for much simpler responses to need, and then we might have a fighting chance of understanding it. So that'll be me, but I was struck by this notion of the evolution.
Okay, thank you very much, Nick. And colleagues may have heard me say before, when we started the Engineering Better Care work, and we actually started to think about a systems approach in a complex adaptive system, I literally overnight, when we started the training, went from feeling quite competent at improvement. I've been working in it for over a decade, including having done the GenQ programme and having a master's in leading improvement, to actually feeling unconsciously incompetent. I didn't know what I didn't know about the complexities within our system and using a systems engineering approach. And I think you're right, it's that evolution, Nick, isn't it, as to how we absolutely develop the skills needed for this scale of work, given it is, as Nicola has described, a different species of work.
Yep.
So Adriana, do you want to share anything new that your group talked about?
Yes, we also talked about the leadership pillars, and obviously everyone was reflecting that it was kind of hard to pick the most important one, which was the question. So we talked around them. Kind of new things that we discussed that others haven't mentioned. Just, number 5, kind of in service of the system and how important that is, and really having a shared understanding of what everyone's trying to achieve, and how that kind of then makes the co-production easier if people are seeing things obviously changing directly from what they're fed in. And to Diana around that kind of discomfort of co-production we talked about. And then there was a little discussion around the stewardship, so that first pillar, and a great point about how stewardship can mean different things to different people. We kind of talk about it in different ways, about clinical antibiotic stewardship, and so being clear on what we mean, and those people who are stewards knowing what resources they're stewards on, the shared aims and objectives, and talking about there can be a healthy way to do hierarchy sometimes, and ultimately you do kind of need that, but it's about building a better sense of trust and acceptance of hierarchy. And then I guess finally around that, just we talked quite a lot about risk aversion, that without kind of risk sharing, you have kind of false accountability, and that makes that quite hard, especially thinking about the left shift, and bringing in kind of third-party providers from outside the sector. I think that was most things we talked about.
That's a great summary. Thank you very much. And thank you to colleagues who are typing the update in the chat box. That's incredibly helpful that we can all read that as we're hearing the feedback. And finally, can I ask Kirsty, you can decline, Kirsty, if you'd rather delegate that back to me.
No, great. I think the only points I would I'd probably pick up that haven't been covered is, I think we talked a bit in our group about well-being, fatigue, and managers being exhausted. I think that's one to kind of consider. I also wondered, and it was kind of coming at it, so I'm coming at it a bit like you are, Ilse, as an organisational development practitioner from over the last 25 years. What we maybe did in the past, we are having to look differently at how we kind of approach things. And I wondered about also a common language around what we expect differently from leaders and managers is missing. And I think the other piece that we talked on, and I think Nick kind of touched on it, how do we move to systems that enable some of this? Because I think the Lothian example, my Lothian colleague is on the call, and also Midlands colleague, a lot of the challenges were the complexity of the system and handing off between agencies, and the inefficiencies that creates. And I think that's probably all I would add, unless there was something else that you wanted to kind of tease out that we covered.
I think you've captured that brilliantly there, Kirsty. Thank you very much. So we've only got 3 minutes left of this feedback session. The question I've got for all of you is, what should we do next? Because it strikes me that if we work well across the Q community and the community of improvers, we have a really good ability to influence how we not only support our improvers to really develop the work to be able to deliver system level improvement well, but actually what could we do that would influence the very senior leaders across our systems that would support all of us to do the improvement work that we're being asked to do at system level? Now, that is probably too big a question for today, but I'd like to ask you all to think about it. And if you've got some thoughts immediately that you think would help, then either, please pop your hand up or pop it into the chat box. But I think for me, Nicola and Nick, and the work you've done with your teams has been fantastic in terms of capturing the learning. I think, Penny, what falls to us now is to really work with Nicola, Nick and colleagues on this call and in the Q community to really make sure that this report and the evaluation and the learning has the maximum impact, so that we can evolve, as we've said, both our skills but also how we serve our local communities.
Thank you, and thank you for that call to action at the end, Elsa, to be doing some amplifying and influencing on the back of the conversation that we've had today. So it just closes me to just thank everybody who has participated. So thank you to the people who were facilitating and feeding back from the discussion to do this in reverse order. Thank you to Nick and Nicola, both for your fabulous work on this report, as well as your presentation, and to Diana and to Elsa, and also to Catherine and colleagues in the systems that participated in this work. Thank you so much for this, really rich set of learning of real value to the wider sector. Just to say a little bit more on next steps, if we go on to the next slide. Firstly, I just wanted to make an explicit connection to the cross-system improvement framework. So I mentioned at the start that this work came out of a group we had been convening of national leaders of improvement across the UK and Ireland. This framework is also something that emerged from that group. And there are so many connection points between the work that we've been talking about this morning and this framework. So if you haven't discovered it yet through Q, then please do check out our website. There's a whole load of free to access resources, and we're also providing tailored support to organisations through our system improvement support offer. Go on to the next slide. We are going to do some particular follow-up based on the conversation here. So some opinion pieces to follow up from individuals who you've heard from this morning. So please do look out for those, kind of share them on. We're also thinking about opportunities to go deeper into some of the really rich case examples from Scotland, with the Scottish approach to change, the Boost Collaborative in East and North Cumbria, and the work that Elsa touched on briefly from Lancashire and South Cumbria. So there will be both opinion pieces going a bit deeper onto this, as well as opportunities to learn from the case studies that you will find in the full report. And I also just wanted to use this opportunity to highlight a few other relevant resources I've been adding to this list through the workshop, because there's lots of things that I think could be interesting. So we've developed a kind of skills for collaborative change, so to really try and hone the specific skills that might be needed when you're forming a team trying to collaborate across boundaries. And we have also sponsored some work which has generated a kind of really impressive development programme, free to access on a Creative Commons licence to people within the health sector. So that's the Collaborative Quality Improvement Practitioner Programme. Details on the Q site and also via NHS Select. Has a particular focus on things like relational dynamics, system working. So really trying to think about how we can get into the nitty-gritty of some of the themes that we're discussing here. I'd like to highlight our podcast. So that is particularly looking at an improvement that spans whole systems of care. We're just thinking about the next series of that. So if there are examples you think we should be paying attention to, please do drop me a line. A few other things. Gosh, there's a lot we could mention. The Scottish approach to change using the quality management system, as we're saying, we think that is a framework that is going to be relevant at all levels in the health sector. We have a set of resources on what this might mean that we hope you'll find useful on the Q site, together with stuff on the role of improvement in neighbourhood health, and some work we did on thinking about how you align different improvement approaches across a local system. I'm sure there are plenty of other things from the Q community and our members that will be relevant to this work. If there's anything you would particularly like to highlight, please do put that in the chat and we'll make sure that we're helping to amplify the substantial work that the community has been doing in this area as we do future work on this. And yes, thank you, Adriana, for putting into the chat. I know we have some Q members on this call, but not all. We have expanded and changed our application process. So please do, sign up. It's free to participate, and it'll make sure that you're aware of upcoming opportunities to join conversations like the one we had this morning. So thank you very much to all of our contributors, and that includes everybody here on the call who participated as part of the breakout groups. And yeah, please do look out for more work that we'll do together in this area.